Today's topic is quarantine and isolation in university housing. Quarantine is what we do with students who are close contacts of a student who has tested positive for COVID-19. Based on the CDC definition of close contact, which is within 6 feet for 15 minutes or more. Isolation then is for those students who have tested positive for COVID-19. We have another kind of circumstance where one might be asked to isolate, which is someone who perhaps has not yet tested positive. In fact, they may have been tested and tested negative, but given their symptomology, that is the types of symptoms that they have, our medical providers at Student Health Services will ask that they isolate, and those students who are close contacts of theirs must also quarantine during the given period as directed by Student Health Services. We have secured a number of beds off campus for isolating students who live in our traditional residence halls. And in those isolation spaces, we're working really hard to make sure that we have pre-stuffed those rooms with things like linens, with some basic toiletries, and even hopefully with some non-perishable food items and beverages. Once university housing receives information from our colleagues at Student Health Services about a student who must isolate or must quarantine, we initiate an intake process where we effectively interview the student about what they need, what their circumstances are, and that might include anything from very specific dietary restrictions to simply, hey, I needed to get a toothbrush but wasn't able to go home to get it or go to the store to get it before this quarantine or isolation began. I've been very gratified to see that our students want to be here and be successful this fall. They're largely doing exactly what they should do in terms of face covering and limiting their interaction in large groups as we've asked them to do. They want to be on our gorgeous campus. They want to have a safe and successful fall semester.